Dr. Quinn, we got professional sports getting underway. Where there's a lot of talk about high school and college sports about to start up. How do people, I guess, enjoy their sports safely?
Well, the most important thing is we have to remember that we are still in the pandemic and things are going to get better, but we're not there yet. So we have to maintain the CDC recommendations as far as our daily activities, and we have to remember social distancing. Now, the deal is tomorrow night, it's the big night. It's the first game where we restart the NBA season. It was interrupted by COVID-19 for safety, but it restarts tomorrow night, but it's only going to be on television for the fans. But we have to remember, we have to continue the social distance and not all congregate at each other's homes, but maintain our social distancing by watching the games at our own private homes, and we can just talk on the telephone while we cheer the teams on.
That is a great idea, Dr. Quinn. Just a great reminder for people to maintain that social distancing.
Most definitely. Dr. Quinn, we had an issue with the Major League Baseball where they had a flare-up with the Marlins. How do you see this happening with the NBA? I mean, they've been in that bubble, but do you think that there are going to be any problems there?
Well, I mean, they have so many safety protocols in place. I mean, the NBA, they work very, very long hours as far as developing these protocols. They have to test every day for everybody involved, including the players, the coaches, everybody tests. And if anybody tests positive, they're removed from the actual grounds. That's the Disneyland in Orlando, Florida. They're removed, and everybody around them is continuously tested. But they call it the NBA bubble, and they call it for a reason, because it's like a bubble, and everybody in the bubble, they're considered safe. Now, the people that are the workers who make the beds and cook the foods, they can come and go, but they have to follow very strict guidelines as well. So I feel very confident that this will be a good season, and LeBron James is going to take it again.
The king, right?
You sound excited. Talk a little bit about high school. There's a lot of talk about high school sports this fall, whether we're going to have them or not. There's some guidelines right now as they push the high school season back. What do you say to fans of high school sports right now, or even college sports, and whether we can do this safely?
Well, like I said at the beginning, we have to remember the CDC guidelines and remember what our weapons are. Right now, we don't quite yet have a medication that's been proven to be curative or very good in treating COVID-19. So we have to use behavioral protocols such as social distancing, wearing masks, keeping our hands clean, and just making sure we follow those guidelines. So it's not yet 100% certain how this is going to roll out with the high schools, but they're going to really work hard to make sure that these students are as safe as possible. But say, for instance, they do let family and friends come watch the games. We still want to stay separated, where maybe we don't just all sit in the bleachers, but we stay separated in the field around the stadium. But we just want to make sure that we don't come into contact with each other, because that's the best way that we can help protect ourselves and our loved ones from this COVID-19 pandemic infection.
I got to ask you this too, Dr. Quinn. Now, it's believed that the risk is lower when you're outdoors, but what about if the wind picks up or something? What happens with that? Can the droplets be carried by the wind?
Right. Now, that's a good point, because the deal is, theoretically, the CDC has recommended 6 feet, because that's normally how far the droplets will contract if you talk, because you can contract it by sneezing, coughing, or just talking. If the wind blows, theoretically, the droplets can go further. That's why you want to try to limit exposure to other people as much as possible, and maybe don't go places you don't need to go. Just maybe stay at home as much as you can. But just remember, things are going to get better, because we're going to get a vaccine. We're going to get effective medications. I mean, scientists, doctors, researchers, they're working night and day. Things are going to get better. We just have to be patient, and we have to stay smart.
Thank you so much, Dr. Quinn, for all this valuable information. We can never reiterate the mask and social distancing. Thanks again. Now,